Doctors on Reddit. What medical myth do you still hear surprisingly often?
Wearing reading glasses will make your near vision worse. No, aging makes your near vision worse. My eyes can't be dry, they're watering all the time. Watering is, in fact, a symptom of dry eye disease. Eating carrots makes your eyesight better. Nope. Carrots contain vitamin A, which is important for vision, and vitamin A deficiency can definitely result in vision problems. But more carrots does not equal better vision.
Fun fact, the carrots give you better vision. Myth was started in WFID to hide radar's existence and uses from the Axis. Oh no, we don't have any new war tools. Nah, our pilots just eat a ton of carrots.
Natural supplements are not better or safer than proven medications. Have seen people die with treatable cancer, heart disease, or liver failure, or get very sick from these untested products, and they cost a lot. Please be careful.
St. John's wort is used by all sorts of people who don't know it, interacts with a very long list of medications including birth control, chemotherapy, and statins.
I tried it once when I was working with a nutritionist, and it was like, hey, you haven't had a migraine in a while. Would you like to have them all at once?
Hey, so you want a dietitian? In the US, at least? I could be a nutritionist in literally 2 weeks based on some online courses I just found, and the title being unregulated in most of the US. To be a dietitian, I'd need a master's degree. Just a little note there for you if you ever want to check that out again in the future.
I'm not a doctor, but I work in end-of-life care. Many people think hospice workers are there to give morphine just to hasten death. I've even heard the rumor that we get some kind of bonus if someone passes sooner. This idea is sadly common, especially among older people. It's hurtful and deeply unfair. I hear it so often that I have to bite my tongue not to react. Morphine isn't prescribed to make loved ones die. It's given when they can no longer swallow pills and they're in pain or suffering.
I lost my father 2 years ago. The hospice nurse that we had was an angel. I will go to my grave appreciating all that he did for us. That job isn't for everyone, and it shows.
As a friend of mine once said, even arsenic is all natural.
Insurance covers it.
First time I got insurance on my own, I had a whole slew of blood tests. Made sure to go to a place that took my insurance. Had to pay all $1,200 of it because I didn't know about deductibles and all that. I thought covered meant covered.
The doctor told me I had 6 months to live. Not that I can blame people for possibly misunderstanding the details of a cancer diagnosis. What the doctor actually is saying is that the median survival is 6 months. Half live more than 6 months and half live less. This might seem trivial to some of you, but I think this misunderstanding hurts trust in doctors at the exact time they need it most. How many times have you heard something like, "The doctor gave me 1 year to live and I'm still alive 3 years later"? The implication for some being that doctors don't know what they are talking about. I have seen too many people forgo effective treatment to do something like smoke marijuana instead of having a bone marrow transplant for their leukemia. And misunderstandings like this are partly to blame.
Women have been having babies for thousands of years, as a rationale to dismiss risks. Childbirth has incredible risks, most of which are carpet swept under the joy of having kids, and leads to a lot of shock during pregnancy, birth, and postpartum. Every would-be parent should be assessing the risks before getting pregnant, not as a deterrent, but as a way to be fully informed as various things can unfold, and how to be ready for them.
Yes, they have, and they and the babies have been dying for thousands of years.
There's a reason Disney movies always had an evil stepmother, and it's because the mother dying during childbirth was so common.
Whenever someone has a concussion and we send them home after a normal CT scan, I always get asked how often they need woken up and checked on.
The ivermectin is better for cancer than standard therapies myth is growing. And whenever a patient shows data, it's always cell culture data.
Catching a viral illness because it's cold outside. Sugar feeds cancer, nipping a bronchitis in the bud by taking antibiotics.
You can catch a cold by being outside in the cold and wet without a jacket on, or catch a cold just by sitting around in wet clothes.
That babies and toddlers don't have kneecaps. They have kneecaps. They are just cartilage, so you can't see them on X-ray. Take a peek at an X-ray of a toddler, baby foot, or hand, and it would look like they have no bones at all.
This is how you can determine the age of bats. You shine a flashlight through their wings to look for joint ossification. If it's a pup or first-year juvenile, the joints are clear like a bubble between the phalanges.
I'm watching Hell on Wheels right now, and I'm getting pissed off about how often this comes up because it's a Western, so people keep getting shot. Long after someone stops bleeding, someone with minor medical training decides the bullet has to come out and starts digging around inside of them and opening the wound back up. They act like keeping a bullet inside is what causes infection or internal bleeding or something, and removing it instantly cures that and allows them to heal up. Maybe that was the belief back then? IDK, but they don't need to keep showing it over and over again like it's some gospel truth they're trying to spread, Lemoyo.
What I hate is that people think there's some big conspiracy and we refuse to admit there could be side effects. Everything in life, from the water that we drink to chemo, has risks, benefits. And when we do come up with safer vaccines without the additives that were removed for unfounded concerns, they don't change their mind. I do not even know how to talk to folks so stuck in this mindset, as I can't fathom why they would come to me in the first place. I also really want my big pharma check. I might have been given a pen once or twice, but otherwise I've never gotten anything. Where is all this money they talk about?
My local moms group on Facebook has so many people who are convinced that their doctors are evil because they won't give antibiotics at the beginning of a virus to keep it from progressing or turning into pneumonia. Not that I'm surprised, as other favorite topics include which doctor won't make me vaccinate my child and what hospitals don't make you give vitamin K vaccines. They have good info on local events, but the rest of the conversation makes me want to scream.
You need to drink 8 cups to 2 liters, whatever of water a day to be healthy. There is no such evidence-based recommendation. The best science says to drink to your thirst.
This recommendation was based on the same flawed and misappropriated data as the recommendation for 2,000 calories per day. It's really only useful for people who don't get adequate thirst signals, like the elderly.
This is a pet peeve of mine. I've had several people tell me I need to drink more water. I tell them, okay, bring me one peer-reviewed study saying I should have X amount of water per day, and I will. But you won't be able to find one. Of course they don't believe me. Then later I rarely come back and tell me how amazed they are that they can't find any evidence of it, or B, commonly, don't say anything. So I'll ask them about it later and they let me know that while they can't find any quality evidence of it, they just know it's true, it's well known.
Question though. It often feels like I'm not thirsty, and then next time I have water, I'm chugging 12 Oz in one go. Many of my friends do not drink water at all. Or if they do, it's a very small amount, but they claim not to be thirsty. I guess the question here is, what's up with that?
Myth 1. Going to bed with your hair wet will make you sick. It doesn't. It can lead to hair damage and headaches, but it doesn't make you sick. Myth 2. You don't need to take your whole antibiotic regimen. You can stop when your symptoms stop. For the love of God, please don't do this. Please always finish your entire antibiotic regimen as directed, unless your doctor tells you otherwise.
That you have to take the bullet out. You don't. The holes the bullet made are the problem. Just taking the bullet out doesn't fix anything. Hard eye roll every time I see this in movies.
It sure makes it annoying when they inevitably need an MRI and you can't prove the bullet isn't ferromagnetic.
I mean, removing foreign bodies and debriding wounds is a good idea for preventing infection. It's just not a magic cure-all for bullet wounds.
Former speech therapist here, who dealt with adults with difficulty swallowing. So many people think that if you are choking, you should raise your hands above your head to dislodge the food.
ICU nurse here. This is a new one I just heard today. A patient's family member asked me if the blood we were giving the patient had been screened to make sure it wasn't high-pressure blood. I didn't delve into what they meant by that.
Teeth are luxury bones, and that's why insurance doesn't cover them. Teeth are not just cosmetic, they are also needed. Without teeth, the ability to chew food properly diminishes, leading to potential nutritional deficiencies and digestive problems. Not having teeth also causes bone loss in the jaw and speech problems. Not to mention all the trouble that comes with an infected tooth. They can and will kill you without treatment.